Today against the Cleveland Browns, we saw offensive lineman for the Tampa Bay Buccaneers, Tristan Wirfs, go down with a devastating leg injury, and this was a very gruesome one right from the beginning because it involved him being carted off of the field. Now, based on how the injury looked, initially there was a lot of speculation regarding the severity of the injury. However, there is some good news coming out of the Buccaneers camp. So far, it looks like he has had x-rays and they have been negative, and there were also reports of him walking around in a walking boot in the locker room. Based on the injury video, however, there are several structures in the leg, specifically the ankle, that could be involved with this. And even though so far the x-rays are negative, he is due to have an MRI tomorrow to determine the actual severity. Since some people may not be too familiar with the structures located in the ankle and what could be involved in this particular injury, I'm going to go ahead and focus on that with this video. Welcome back, everybody. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over what that person should expect when going into physical therapy for that particular injury. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we can see here that as Wirfs is blocking, as he's blocking that Browns defender, another one is actually coming down from a jump, and he's actually going to fall into the outside of that left leg. Now here I have a model of the foot and ankle, and so the two long bones in the lower leg, you have the tibia, which is this bone right here that we often talk about as being the shin bone. That's going to come down and form the inside portion of the ankle here, and that's known as the medial malleolus. Then on the outside here, we have the fibula bone, which is going to come down and form the outside portion of the ankle, which is known as the lateral malleolus. And as we look further into this model here, there's a bone below those bones known as the talus bone, and those three bones together make up what we know as the ankle joint. Now in the ankle, we also have some very important ligaments that are located on the outside and on the inside of the ankle. Now, for the structures on the outside of the ankle to be stressed, that person usually is going to roll their foot inwards this direction in that classic ankle sprain. And for those ligaments on the inside to be stressed, the opposite typically will happen, where a person is going to fall this way and that foot is going to go into more of an everted position. Now we can see here in the video that as he is standing and planting with that left leg, that defender is actually coming in and putting a force from the outside coming in. So he's putting more of an eversion stress at that foot and ankle joint, which is going to stress the inside portion of the ankle here. And the ligament that is mainly affected in this position is known as the deltoid ligament, and that actually comprises a lot of stability in the inside portion here. Anytime we see this sort of mechanism of injury, obviously we're going to think that there is going to be a fracture involved, especially when somebody is carted off. But once again, the x-rays were negative in this case, and that is very fortunate because we've seen time and time again where this similar mechanism is going to implicate either the fibula or the tibia, or sometimes even both. One other thing that could be implicated here, of course, is the joint directly above the ankle joint, which is the knee joint. Now, anytime you have a force of somebody coming from the outside in, that's known as a valgus force. And a valgus force is going to go just like this. And you can see that as I do this, this is absolutely stressing the medial collateral ligament, or the MCL, because that is located on the inside of the knee. It can also affect the medial meniscus, which is right in through here. And finally, this could affect obviously the ACL as well. So one thing to always look for in these types of mechanisms is to see whether or not that person is also dealing with a knee injury. Fortunately, because he was walking around in a walking boot, it does not sound like he's dealing with any sort of a knee injury. Usually that player will be immobilized in a knee immobilizer and they will be non-weight bearing. Right now, unfortunately, they have not released the specific injury that Wirfs is dealing with, but based on that mechanism of injury and the fact that he's walking around in an ankle boot, it sounds like that he is dealing with some sort of an ankle sprain, whether that be the deltoid ligament in here or one of those three lateral ligaments on the outside portion of the ankle. Once again, once we find out the results of that official MRI, we'll know specifically, but typically if somebody is dealing with an ankle sprain of some sort, then they're going to be placed in that walking boot. Now there is a grading system for these ankle sprains, they range from grades 1, 2, and 3. In a grade 1 ankle sprain, typically the affected ligament is going to be stretched, but there will not be any tearing. In a grade 2, this is when you're going to get some stretching and partial tearing of the affected ligament. And finally, in a grade 3, this is when you're going to have a full rupture of that ligament. Now, obviously a grade 1 ankle sprain is the best case scenario in this case. And typically with a grade 1 ankle sprain, a person, depending on the severity and how it feels and the swelling and pain and things like that, this can take anywhere from about 1 to 2 weeks. If a person is dealing with more of a grade 2 ankle injury, this is when it can extend all the way up until about 4 weeks. And finally, in a grade 3, this is when a person may require surgery because that ankle joint is just going to be very unstable. When we get somebody in physical therapy for an ankle sprain, typically what we'll do immediately is that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. This is because we want to essentially just focus on pain control and to reduce the swelling to the joint at that time. Then as the person starts to feel better, usually around the 7 to 10 day mark or so, this is when we're going to start to work on gentle range of motion, and we're going to try to restore the normal motion to the affected joint. Finally, after that, once we restore some of the normal range of motion, that's when we can start to effectively work on strengthening. And then once everything has essentially come together, then we can go into more sport-specific movements as long as the follow-ups with the doctor have gone fine. It does sound like Wirfs has dodged a major bullet in this case with the fact that the imaging so far has been negative, but unfortunately it does look like he will be missing a few weeks. It really just depends on how he presents when he goes to the doctor and how his follow-up sessions go. If I hear any updates regarding his case, whether I get the results of the MRI tomorrow or if I find out any results from any of his doctor visits, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. And that's it as of right now regarding Tristan Wirfs' most recent ankle injury. I wish him the best of luck moving forward. It sounds like overall his prognosis is going to be a good one. Of course, if they do not find something severe on that MRI. Once again, if you like this content, please subscribe to the channel because I will be making a lot of this content in the future. Thanks for tuning in, and I'll see you next time.